going to give you a bit of gin and tonic. If you haven't had one already.
A little bit of lime.
A little bit of lime.
So the main differences I would categorize them into, some of them are patient differences and some of them are anesthetic differences and definitely some of our post-op protocol differences. So we're picking patients that are definitely fit, healthy, and mobile and motivated, using a lot more short-acting anesthetics. So the patient does not get a general anesthetic, they get a spinal anesthetic using a short-acting type of local anesthetic. The anesthetist is a really skilled anesthetist who's able to put anesthetic in the areas that can block nerves for sensation without blocking nerves for motor power. So the patient will be numb, but able to move their leg very quickly after the operation to get up and move.
We're using a short-acting local anesthetic, which will last about an hour and a half. And then the short-acting spinal, I think, is quite novel. Having these patients after a spinal anesthetic get up and do stairs, I think it's quite amazing.
The combination of a motivated patient, a short-acting anesthetic, and a quick operation is allowing these patients to get up and walk within a few hours. For the first few days, lots and lots of ice, and we're going to give you some prescriptions for pain medication.
You're the man.
All right? Okay.
Okay, perfect. Thank you.
You're welcome. So surgery went well. He's a fit, healthy 56-year-old gentleman who's had a previous ACL reconstruction, and like a lot of patients who have ACL injuries, he's gone on to develop a pretty severe form of arthritis with a lot of deformity and stiffness. So all things considered, I think the surgery actually went really smoothly.
Step, new leg, old leg. Good.
By not staying in hospital for a day or two, sometimes 3, we save on nursing costs, medication costs, we save on physiotherapy costs. All those things are basically being done now as outpatients. Patient stays at home, so they're eating their own food, they're sleeping in their own bed, they don't have to have a facility to house them. They're not being looked at after 24/7 by a nurse.
I think it's a great idea. I think if you can, get your operation and get all set up and get back home as soon as you can, and it just normalizes things.
When I started this job, it was 4-point-something days in hospital. Now it's about 2 days in hospital. But to bring it down to 4 hours is incredible stuff.